Hi, my name is Sarah Williamowski, and today I want to tell you how Keheala is transforming healthcare in the developing world. Across the developing world, $2.8 trillion is spent each year on healthcare. This money covers the cost of facilities, doctors, nurses, and medication. It's all there. But none of this spending matters if patients are not accessing or utilizing it properly. It's hard to be a patient in the developing world. I want to introduce you to Elizabeth, a single mother from Nairobi, Kenya, who was diagnosed with tuberculosis. She is totally alone in her patient journey, facing some serious challenges that have nothing to do with medicine. She walks an hour in each direction to access care, something the World Health Organization wants her to do every day for 6 months, forcing a trade-off between going to work to feed her family or following the protocol. And Elizabeth can't talk to family or friends about these challenges due to a powerful community stigma that surrounds the disease. Healthcare systems lack the resources or the expertise to address these challenges, which exist in the homes and in the communities outside of health facilities. Importantly, the challenge is not medical, it's behavioral. Keheala is a cloud-based behavioral health platform for the developing world. It extends the reach of the healthcare system to directly empower patients with reminders, information, motivation, and support all across basic feature phones. Keheala uses behavioral science and data to save lives while lowering costs for the healthcare system. So how does this work for patients? Patients are screened by dialing a short code. Individuals flagged as high risk are nudged to a local facility where they are diagnosed. Leveraging our predictive analytics and machine learning capabilities, healthcare workers access a decision support tool that allows them to differentiate treatment protocols and optimize scarce resources. Patients are empowered throughout their journey, supported by information, motivation, and dedicated support, all from their mobile phones. Changing behaviors is really hard. However, research from the social sciences over the past 20 years has shown how small changes in the decision-making environment can lead to large changes in behavior. Keheala specializes at designing and implementing such nudges, as they are frequently called. The left-hand screen is a generic verification screen. The problem is it leaves room for plausible deniability. With Keheala, the action you're claiming to have done is explicit. Yes, I have taken my pills. This is a lie of commission which removes plausible deniability and has been proven to reduce lying. Also, with the generic screen, you can say no to taking your medication. Keheala plays with decision architecture to remove the undesirable behaviors while clearly communicating our expectation that the medication be taken or that you do so later. These are just two examples on one screen, but every interaction we have with patients is built from the ground up with these behavioral principles in mind. This approach works. We know that because we tested it. In partnership with the Kenyan Ministry of Health, USAID, and academic partners at MIT, we implemented a proof of concept randomized controlled trial to demonstrate the value of behavioral nudges delivered across basic feature phones. Patients using our intervention experienced a 68% reduction in the unsuccessful health outcomes, including death, failed treatment, and loss to follow-up compared to the standard of care in Kenya. At scale, just for tuberculosis and just in Kenya, these results would translate to over 1,500 lives saved and over $24 million in cost savings every year. Based on these results, we've scaled to support over 18,000 patients across 8 counties and 900 facilities in Kenya. Now that we've shown our health impact and our ability to scale, we are growing our customer base and into new geographies and new use cases. We recently signed with Johnson & Johnson, the United Nations Development Program, and Sanofi Pharmaceuticals hired Keheala to support patients in South Africa with their HIV and TB preventative therapy. COVID-19 has highlighted the need to be able to support and motivate patients away from the health facilities, and demand for Keheala has increased during this time. Keheala is well recognized. Our approach has been published in the top medical journal in the world, the New England Journal of Medicine, covered by the New York Times and the World Economic Forum. Additionally, USAID recently selected Keheala as one of the most promising health innovators ready to scale. By addressing the behavioral gaps of the healthcare systems, we are reducing costs for healthcare providers and insurance companies while driving revenue for pharmaceutical companies and telecoms. Keheala captures a portion of this value by charging these customers a simple per-patient monthly fee. In the developing world, there are 38 million people suffering from TB or HIV and 115 million new expecting mothers every year that can benefit from Keheala's intervention. At an average price of $23 per patient, there's a market of $3.5 billion every year that Keheala is looking to capture. Our existing adherence and support product is already selling on the market. Building out our NTAP platform for multiple diseases will accelerate adoption and growth, enabling us to support over 1.3 million patients in the coming years. We have a strong management team with the experience and expertise needed to expand and scale Keheala. Additionally, we hire local teams in the geographies we operate to focus on business development and operations. We are currently raising $2.1 million in equity, which will enable Keheala to build out the end-to-end platform. We are going to build on our behavioral expertise and the success of our in-market adherence and support tool to address behavioral challenges throughout the patient journey. One solution, start to finish, multiple diseases. Additionally, we will invest in our commercial growth, expanding our reach with new sales channels. Keheala brings the power of machine learning and behavior change to basic feature phones in ways that improve healthcare access and treatment outcomes for the base of the pyramid. Partnering together will enable Keheala to achieve its full potential, delivering double-digit financial returns alongside societal impact. With your help, no one needs to suffer from the diseases we have already solved. Thank you.